Good evening, everyone, and welcome to our presentation on what you should be doing to get ready for your MCAT. My name is Justine. I'm going to be leading us through some discussion on strategy and practice, looking at both discrete and passage-based questions that you can see on your MCAT. I am joined by my fantastic colleague, Paul. So if you have any questions, concerns, as we go through our presentation, definitely reach out and let us know. I always say when it comes to our classes, I want everyone to feel comfortable asking questions and making mistakes, because this is the time you want to make mistakes, not on test day. So if you have questions, definitely ask them. If you have, if there's content that you don't know, make mistakes now. Figure out what you do and don't know so you get it good on test day. Hey there, Isha, welcome. So what we're going to take a look at in the next hour is we're going to talk about just the MCAT overall and how it, factors into admissions. Hey there, Sasha. We'll look at some strategy, and like I said, we're going to focus on both discrete questions, so those 15 standalone questions you get in each of the science sections, and we're also going to look at a passage. The overwhelming majority of questions that you'll see on the MCAT are passage-based. So there is a certain strategy for working through those in a time-effective way. So we'll take a look at some passages as well. Now, the first thing I want to tell you about the MCAT is probably something that you've been hearing pretty much your entire time of being a pre-medical student, is that the MCAT is really important. And we actually did some research talking to different admissions committees from a large sampling of medical colleges. And what we found is that almost 75% of an admissions decision is made with two numbers, your MCAT score and your undergraduate GPA. So before they even get to see you as a human being, pretty much you are reduced to two numbers. Now, depending where you are in school right now, you may or may not have a lot of control over your GPA. Like if you're like a freshman or a sophomore right now, yeah, you can certainly do a lot to shape your GPA. However, if you're a junior or a senior, especially senior, your GPA is kind of set in stone. There's like a little bit of wiggle room there, but it's generally going to stay roughly where it is. However, your MCAT score, that's like Play-Doh right now. Like you can really shape that and mold it to be whatever you want it to be. So if you have a maybe not as stellar GPA, you can certainly make up for that with a really awesome MCAT score. The converse is not true though. If you have like a 4.0, that does not give you like an opportunity to slack off on your MCAT. So regardless, the MCAT is there to help you and show schools not necessarily that you're going to be a good doctor, but it's there to show them that you're going to do well in medical school and you're going to do well on your boards, because that's really what they care about. It becomes a numbers game. So, oh yeah, Sam read a 3.8 GPA is pretty good. Again, and if you get an awesome MCAT score with that, you'll be a pretty competitive applicant. And there actually are websites out there that you can use to look at your GPA and your MCAT score to figure out where you would be most competitive. So it really, a lot of it comes down to those two numbers. After that, experience is important. So you want to make sure you're doing some shadowing. But again, it really comes down to your MCAT score. So give yourself enough time to study. And actually, do you know how many hours most students study for the MCAT? You think is a recommended study time? What do you think? I know whenever I first started studying, I felt like I would just have to spend like my entire life studying. But it's actually either, depending on where you are, it may seem like a lot. They have 3 months is pretty typical, Sasha, anywhere from 3 to 6 months. And that depends on how much time you have. Exactly, Irene, like 3 or 4 months. In general, you're looking at somewhere between 300 and 350 hours. Yeah, some people study for a year. Again, it really comes down to how much time you have each week. So if you're the kind of person who is taking some time off from school or work to study for your MCAT, yeah, you could totally crank that out in like 3 months. If you are working or if you're also a full-time student, you're probably going to need more time to do your prep. So generally what I like to do is, assume you're going to spend 300 hours studying, and then from there, figure out how much time you either need to study per week to get it done by a certain day, or think about how much time you have per week to study and use that to set your testing. So you really want to take the MCAT when you are ready. The other thing to consider is that you want to give yourself adequate time to practice. Until I took the MCAT, I had never taken a 7-hour exam. The longest test I ever had in college was my physics final for Physics 2, which was 4 hours. That was certainly grueling, but there is a very large difference between a 4-hour exam and a 7-hour exam. So you definitely don't want like the actual test to be the first time that you take a full-length exam. It really is like a mental marathon. From our experience, most students to get to their desired score will take somewhere between 6 and 10 practice tests. So I implore you now, depending on when you are testing, whether it be, sometime in early next year, or maybe you're just getting started and you have several years. Start looking into resources for practice tests. I know that we have a lot of different practice tests. AMC does. We actually have all of the AMC tests with our classes, but you want to make sure that you give yourself adequate practice. One of the number one mistakes that I see students make is study content, practice later. You can go through and you can read a MCAT prep book cover to cover, but that's not the way that the MCAT tests you. The MCAT is a critical thinking test. The only way to get really good at that is to do it. So that's the mistake that I made when I first started studying. I read my prep book cover to cover, took one of the Kaplan practice tests and bombed it. So if that's you, if you've had that experience, you're not alone. So give yourself adequate time to prepare. Give yourself adequate time to practice. So if you get nothing else from this event tonight, I want that to be your main takeaway. Content and practice. Specifically the and practice part. Because that's really what we're going to focus on tonight as we work through practice questions. Strategy and practice. So whenever we are taking our exam, there are several things that you want to focus on. First of all, you want to be strategic in which questions you start with. So just like in an ER, where you always start with the most critical patients first, on the exam, you're going to start with the most critical questions first. And if you think about it, the kind of questions you want to start with, oh, and Azra, yes, you are definitely allowed to use the bathroom. So that those sections, you have a 10-minute break between the first and last two sections, and you have a 30-minute break in the middle for lunch. So you definitely want to go to the bathroom on every break, and you definitely want to have some snacks on every break. So that's the other thing that is helpful about the practice test, is you can start to kind of like train your bladder to not have to pee for like 90 minutes. And you can start to see what types of snacks are really good for maintaining your energy and focus for a long period of time. So there's many benefits from taking practice tests other than just, getting your endurance and pacing and all that down. You're getting your biology ready for it as well. Now, once we go through and look at our answer choices, that's going to help us to identify, is this a now or later question? We call that same decision triaging like you do in the ER. You want to start with the questions that you can answer quickly and confidently for several reasons. One, that's how you get more questions right and more points. And two, that's how you start to build what I call your MCAT swagger, which is the confidence that you'll have to make it through the rest of the exam. So you're starting with easy questions first, easy passages first, and then building up to that harder stuff at the end. You're also going to look for patterns in the answer choices, because that's going to also help inform how much you're going to have to think in order to answer the questions. Now, so there is like a maximum number of times that you can take the MCAT. I believe like the maximum number of times you can take it is like either 5 or 7 times. Generally speaking, if you have to take it that many times, it's probably not going to reflect well on you as an applicant. If you can, the best way to go about it is one and done. So only take the MCAT when you are ready. I see a lot of students actually do this where they're like, I'm going to go for like a practice run just to see how it goes. Don't do that. Don't do that. You only want to take the test when you are ready. So if you've taken it once and things didn't go as well, that's fine. You can do it again, and you want to show significant improvement, and you can essentially use that as an experience to say, I wasn't totally prepared. I learned from my mistakes. I've become a better person. I've grown as an individual. What you don't want to see are multiple attempts where you don't see improvement. So you've taken it once and you didn't do well. Learn from your mistakes. Do the practice. Be scoring consistently, and then get to your desired score. And Dominic, that actually depends on how you are as a learner. For me, I actually prefer the online course that we had, mainly because you had Paul is actually like an off-camera teacher in a lot of our classes. And there's actually in our classes, there's like a separate box in addition to the questions box where you can chat just one-on-one with an off-camera instructor. That to me was really great because although you may not seem it because I'm like, woohoo, on camera, I'm actually like a really shy, awkward human being in like real life. So like I wasn't the kind of person who'd be like, in class, but I was the kind of person who'd be like, let me talk to this person in this chat box and ask all of my questions. So it comes down to like how you are as a learner and how you like to interact with people. Both are really great. Again, it really comes down to how you like to learn. So do some self-reflection, and that will really help you to figure it out. But both ways can get you all of the same content and strategy. It's just what kind of environment is best for you. And a few more questions, definitely, Paul would be happy to talk to you a little bit more about like the different ways that you can prep. So let's go through some practice questions together. So the first thing we're going to do when we look at our question is we're going to take a look at the answer choices and again look for patterns. Now when I look at these answer choices, I see essentially what I like to call a 2 by 2. So I see decrease versus increase, and I have 3 versus 9 times. So this gives me a very concrete aspect to focus on as we answer this question. Now, also notice that we're given like specific numbers in our question stem, but that's not really what we have to pay attention to. Looking at a fold change, not a specific numerical change. So let's look at what we got. So we have a bond between two phosphate groups, and ATP is this certain length. By how much would the electric potential energy change if the bond length were 3 times shorter? So here we are decreasing a bond length. The other thing to consider here is the actual property we're looking at. Now, in electrostatics, we have electric force, electric field, electric potential energy, and electric potential. Each one of those things has a different formula associated with it. So we got to make sure that we are identifying the correct thing for which to ascribe a formula. Here we're looking at potential energy versus radius. So if you're not shy, go ahead and tell me in the chat, what's the relationship between potential energy and radius in terms of our electrostatics here? And this is one of the most common mistakes that I see people make, is confusing this with electric force. Now the formula that we want to use here, Sarah, that's electric field, not potential energy. That is one of the that is a valid equation though, just not quite the one we're looking for. Here we're looking at electric potential energy. That's U, or just general potential energy. That's where we have our Coulombic constant, we have our 2 charges and radius. What we really care about here is this inverse correlation to radius. So this means that if I were to make my bond shorter, what should happen to my potential energy? Yeah, there's more. Exactly, Isha. And yeah, and you can think about it. The shorter the bond is, the stronger the bond is. Absolutely. So we're increasing potential energy. And Natalie, that's for electric potential. Electric potential and electric potential energy are 2 separate things. So voltage is your electric potential. The U is the electric potential energy. And again, that's why we really want to make sure that we are identifying the thing first and then the formula. So we know that it's going to be larger, it's going to be an increase, and notice that this is an inverse proportionality, not an inverse square. So essentially, C and D are trying to trick you between electric potential energy and just electric force. Because if this were asking about an electrostatic force, that's the inverse square. But we're not falling for those tricks. Again, we are figuring out exactly what we're looking for in an answer, and then we go through and pick our answer. So one of the things that you really want to start doing when it comes to working through questions on the MCAT and really any multiple choice test is not to just dive into the answer choices as soon as you read the question. Like, we look at the answer choices first because this gives us a little bit of insight into what we need to think about. But before you really go through and try to match an answer, you want to think through what the question's asking for, how you're going to go about solving the problem, figuring out what you're looking for in an answer, and then you're going through and looking at your answer choices. So we always predict before we peek. Always make a prediction for what our answer should look like before we really dive into those answer choices. So this is a very common type of question you can see in ChemPhys. Notice that this is electrostatics tested in the general area of biochemistry. Let's take a look at a straight up biochem question. Now, in this case, all of our answer choices are changes. So we're going to be doing some sort of perturbation to a system, and we're going to ask how that system will respond. Now here we have a relatively long question stem. If you ever have like a paragraph of a question stem, sometimes it can help just to read the last sentence because that's where your question is. So you can be given background information, which may or may not be useful, and then the question. So let's look at the question first and then see if we need like the background. All right. So we have, which of the following would most likely happen to the rate of ATP consumption immediately after a cell is moved to a hypotonic environment? All right. And the information that we're given that precedes this question is really talking about the sodium-potassium pump. Now, this is all information that you had expected, is expected background. So the AMC would not actually have to give you this information. If they just said cells use the sodium-potassium pump to help maintain cell volume, that would really be like the bare bones they would have to give you. So let's think about how to utilize this information. First of all, let's consider the sodium-potassium pump. We get 3 sodiums exported for every 2 potassiums imported. So overall, our net movement of ions is 1 ion out. So that's the net progress that's made by our sodium-potassium pump. The next part we want to consider is this hypotonic environment. What does it mean for a cell to be in a hypotonic environment? What does that mean? A cell is in a hypotonic environment. And here's a little mnemonic if you ever get like the hyper versus hypotonic confused. If you put the cell is more concentrated with solutes. Exactly, Isha. Another way to think about it is that there is less solute outside the cell. And that's why whenever you get IVs, they give you IVs of saline, not pure water. If you got an IV of water, your cells would burst because water is hypotonic to a cell. Yeah, exactly, Natalie. It's the environment with less solute. So whenever a cell is placed in a hypotonic environment, water is going to rush into the cell. It's going to cause it to swell and look like a big O in the word hypotonic. So if the cell is using its sodium-potassium pump to maintain its cell volume, it essentially doesn't want to enter that O phase. Like that's just not good for cell. So is it going to increase or decrease the activity of that sodium-potassium pump? Remember, the sodium-potassium pump allows us to export 1 net ion. Is that good or bad for hypotonic environment? Think about where our cell is right now. There's more solute inside of it than outside the cell. Water is going to flow into the cell down the water's concentration gradient. Problem is there's too much solute in the cell. So exactly, Natalie, it would increase. So we would expect the activity of the sodium-potassium pump to increase after this movement. Exactly, Sasha. And notice the key phrase in our question stem, immediately. So boom, we put it in a hypotonic environment and sodium-potassium pump goes up. That matches answer choice A. Notice, however, if that immediately wasn't in the question stem, there's answer choice C waiting as a trap. Now, on test day, you can highlight within the question stem. You can highlight passages. You can highlight answer choices. Words like immediately, words like not, but, except are all words in question stems that I like to highlight. because it's allowing you to hopefully avoid one mistake on the exam. So notice this question, there's a lot of moving parts. There are built-in trap answer choices because in order to be an excellent doctor, you need to pull in information from multiple sources, and you also have to have a keen attention to detail. So that is one of the skills that, although like the AMC doesn't like explicitly come out and say like attention to detail is like skill like 5 or anything, it is something that they are looking for in future doctors. So something to keep in mind, one word in a question stem, one word in an answer choice can make the difference between getting a point versus not getting it. So make sure you're paying close attention. You don't want to rush through questions. That's why you triage. Start with the easy questions. You don't have to rush. Let's take a look at a passage. Now, just out of curiosity, you can tell me in this chat, what do you find to be most intimidating about passages? What do you find to be most intimidating about them? Because I know for me, generally, I was scared of passage-based questions a lot more than I was scared of like discrete questions. And you have a lot more passages on the exam than you do discrete questions. So we got to get our comfort zone here with passages. For me, yeah, the amount of information, exactly, Isha. Now, you can get all sorts of new information. Yeah, the length of them, exactly, Dominic. Yeah, the sheer volume of the text, absolutely. Now, length, you're afraid you're going to miss something. So when it comes to passages, those are like that's all of the things that I see people like most concerned about. So let's work on how to decrease the cognitive load of reading a passage. Now, the first thing I'm going to tell you is not every piece of information in a passage is created equally. It's not. So there's going to be useless garbage that you read. So let's first think about what is important information to read on the test. If you already know something, skim it. There's no point spending a lot of time reading something you already know. If you see a new word you haven't seen before that's defined, highlight it. This is going to make it easier for you to find that word again when you get to the question. Same thing with constants. Same thing with like if you have a passage on like some sort of disease and they tell you the mode of inheritance, throw some yellow. So you want to be strategic about how you highlight. Less is more. So you don't want to like just change your background color to yellow. You want to be strategic about what you highlight. You know, names of people, dates, constants, defined terms. Those are all things I like to highlight. And that like encompasses all 4 sections of the MCAT. Next thing is thinking about what you pay attention to when you're reading. The MCAT is not an obscure science test. It's not. So they may give you like a passage on like how this like fancy, I don't know, mass spectrometer works, but it's going to come back to some like general like electrostatic or physics thing. You can be tested on some sort of like obscure disease, but it's always going to come back to this general principle in biology. So when it comes to passages on the MCAT, you're going to see some weird stuff. Like, I'm not going to lie, you're going to see stuff and you're going to be like, I've never heard of that before. But your goal as, you know, a strategic test taker is not to be like, oh my gosh, what is this weird thing I've never heard of? No. Your goal is to say, okay, here's this weird thing I've never heard of. What's the basic science that underlies this? Because that's really what the MCAT is testing you on. It's not about weird stuff. It's about the basic science. So focus on the basic science within the weird stuff. That's how you get the points. And that's what we focus on in our classes. A lot of it's passage-based. A lot of it's just sorting through information and finding the testable nuggets. I always tell my students, and I know Petrus and Paul will say the same thing, I don't want you to think like a test taker. I want you to think like a test maker. So what would the MCAT, what would the AMC test writers find important? Basic science, not the fancy. All comes down to the general principles of science. So as we're reading, that's what we're going to focus on. The other thing that is really helpful is creating what we call a passage outline, because that's the other thing, the sheer volume of information that's given. There's a lot of it there, and I like to think of it kind of like whenever you write an essay, you don't just like write stream of consciousness. You make an outline of like what you're going to talk about in each paragraph. When you're doing passages on the MCAT, you're essentially going in reverse. You're looking at all of the stuff that they talked about and then just pulling out the key facts and writing that down on your scratch paper. What that does is it allows you to kind of organize the information as you're reading it, essentially distilling it down to its most basic properties. And it allows you to be able to find information in a passage more readily. So if you're afraid of length, if you're afraid of the volume of the text, the amount of information given, making a passage outline is essentially like the cure to that pathology. You can organize your information and you can find information a lot more easily in the passage. And that's something that like I found to be one of the most useful strategies I learned as a Kaplan student. That's what we're going to do with this passage. So roughly, in terms of time allocation for passages, in sciences, you're looking at around 8 minutes to complete a passage. And that also includes going through the questions. For cars, the critical analysis and reading skills, that is around 10 minutes for a passage. You outline both. So the same strategy that we're going to look at here today for sciences will also translate to cars, where I feel like it's like extra awesome. Like that made a huge difference for me in my cars score, which originally was like a massive dumpster fire. Like cars was my worst, but the strategies really do make a difference. So let's start building these strategies. So we're going to read through this first paragraph together, and I'll kind of like focus on stuff I would pay closer attention to, and also the kind of stuff I would highlight as I'm reading. Now, this first part, we have appropriate function of the nervous system. This is where I'm starting to skim a little bit because it's like, yeah, of course, stuff needs to communicate. Especially in regards to locomotion, relies on the ability of motor nerves to communicate with muscle tissue. Of course. Pathological conditions that inhibit the ability of neurons to communicate with muscles results in various types of muscular dysfunctions. So this first bit essentially is giving me a little bit of background, and I also know what my passage is going to focus on. It's going to be different issues with muscle, nerve communication. All right, so for example, myasthenia gravis, I would highlight that. Is a disease in which autoantibodies target receptors located at the neuromuscular junction, resulting in inability of the neuron to communicate with the muscle. So this is where I would write down on my scratch paper, myasthenia gravis, and I could totally go through and abbreviate that. Antibody target receptor. And then boom, that's all I would write down. Antibody targets receptor. Interestingly, many patients also have an abnormal thymus. Well, that's common for autoimmune conditions. Remember, thymus is where the T cells mature. So I'm thinking this passage can integrate content from muscle firing, nerves, and maybe like the immune system. So just from this first paragraph, we can get a general sense of what they're going to cover. And then like the last bit's like treatment that sort of works. I'd probably skim that and keep going. So notice the main takeaway we got from this was just what myasthenia gravis is in terms of the cause. We got it. We keep going. That would be paragraph 1. Next paragraph, we got another disease that causes a decrease in the ability of nerves to communicate is Lambert-Eaton. All right, let's highlight that. In this condition, autoantibodies attack calcium channels. All right, awesome. So that's the takeaway here. Paragraph 2, let's abbreviate LE for Lambert-Eaton. Antibody, target, calcium channels. All right, so let's think about what that means. Why do we need calcium channels on nerves? Because for me, I know that this passage is probably going to test me on the mechanisms of getting these two diseases. First one is all about targeting the receptor. So essentially, if I don't have receptors, I can't bind acetylcholine. I can't fire, I can't receive an impulse to contract the muscle. But the second one, Lambert-Eaton, is the presynaptic calcium channels. Calcium is really important for neurotransmitter release at the synaptic terminal. So that's the thing I'm starting to think about as I'm reading. I'm anticipating the questions that they're going to ask. Now, if you didn't automatically go there with your brain, that's because you haven't been practicing this. That's why you do practice questions, practice passages. You start to get that I don't know, that certain ESPN for what the MCAT's going to ask. It's skills you build through practice. No one's born a magical testing unicorn of excellence. You gotta work to get there. So that's what these strategies will help. Let's take a look at our last paragraph. And I'm actually going to read this one silently to myself. And I want you to read along as well and tell me what you would write down in your passage outline. What is important about this last paragraph that seems testable to you? So let's go through and read. Again, tell me what's testable to you. What's testable in the last paragraph? Here we have essentially some different testing that we can do. We have this repetitive nerve stimulation, and we have an administration of acetylcholinesterase inhibitor. So the inhibitor only works for myasthenia gravis. It doesn't work for Lambert-Eaton syndrome. And if I were a betting person, if I were in Vegas, which I've never been, but if I was in Vegas right now, I would bet on a question asking why. Because that's a really interesting fact. Why does the acetylcholinesterase inhibitor help one disease but not the other? We know that both of these are kind of autoimmune, so it's really about what those autoantibodies target. What's different about the physiology behind it? So if I were a betting person, I would bet that there's going to be a question on that. So I'm just going to put ACH, ACE, inhib, help MG, not LE. So just a really quick summary that tells me what's in that paragraph. I also might put something about repetitive nerve stimulation, but again, that's kind of up to you. That to me would probably be more just the figure. So let's look at our figure. This one's a little bit trickier. So essentially what we're looking at is we are stimulating a nerve and we are measuring some sort of response. Now, our passage, like if we go back and look, it just says RNS muscle response. So we're looking at stimulating the nerve and then measuring the response of the muscle. So this is looking at essentially something about the ability of the nerve to communicate with the muscle. That's probably as much as I want to get into how that test works. We have the normal case, so essentially it looks like a normal action potential across our muscle cell. Okay. Notice in myasthenia gravis, we're getting a diminishment of that signal. So as we stimulate the nerve multiple times, the muscle starts to fail to respond. And we see the exact opposite thing happening in Lambert-Eaton syndrome. We do repetitive nerve stimulation and we get a really robust response in the muscle. So that could be why, like, maybe repetitive nerve stimulation would be helpful in Lambert-Eaton syndrome, but not in myasthenia gravis because that muscle's getting tired. So maybe that's something we would write down in the outline. So figure 1. RLS goes to smaller response in MG. We have more frequent action potential in Lambert-Eaton syndrome. Notice that we're writing down in our passage outline is fairly short. We're looking at just the main key takeaways because that's a lot of what the MCAT will ask us about. So let's see how good we did in predicting the questions that they are going to ask. So let's take a look at number 3. So quick scan of our answer choices. These are longer answer choices. Notice that these are reasons. This type of a question is a little bit more challenging because it doesn't have that same structure and it is a lot more focused on critical thinking. So depending on your, I guess, overall feeling of ease and goodness with this topic, you can decide now or later. You can also triage by passage. Honestly, if you looked at this passage and saw muscle contraction and were like, I'd rather not, you could just come back to that passage later. So you don't have to do the questions in order. You don't have to do the passages in order. This is like the ultimate Burger King experience. You can totally have it your way. I've also never been to Burger King, so I don't know if that really is a good analogy or not. But it is true. Take the test in a way that makes sense to your strengths. Play to your strengths, minimize your weaknesses. So let's see what we got. Why does the administration of a medication that inhibits acetylcholinesterase improve the symptoms of myasthenia gravis? Yep, that totally saw that one coming. You have an unexplained phenomenon in the passage. Question's going to ask. So let's think about this. What is acetylcholinesterase? Let's break this down piece by piece. This is the kind of critical thinking. This is the gears that should be turning in your brain. So first of all, what is acetylcholinesterase? We know it's an enzyme based on its ACE ending. Have acetylcholine as our neurotransmitter between the neuron and the muscle. Acetylcholinesterase is an enzyme that's present in the neuromuscular junction that degrades acetylcholine. So if we inhibit this enzyme, so it's a really, like, you're on the right track, but you got it a little bit backwards. It actually stops the communication. And again, don't worry about making mistakes here because, again, making mistakes is how we learn. I always say that's the main difference between a Kaplan student and a Kaplan teacher is I've already made all of the mistakes that you either are in the process of making or will make before your test. So acetylcholinesterase is what breaks down acetylcholine in the neuromuscular junction. So if we inhibit this enzyme, we should see more accumulation of acetylcholine in the synapse. Now, for myasthenia gravis, remember, this was a breakdown of receptors on the muscle. So essentially, if you have more acetylcholine, you can really saturate those receptors. That's what we're going to look for in an answer choice, something that says we have more acetylcholine, we can really saturate the receptors. Notice A is about inactivating antibodies. We can't really do that with what's going on here. Increases the concentration of acetylcholine, looking good, allowing for greater stimulation of unaffected receptors. There it is. Notice I actually do not need to look at answer choices C and D. So if you make a strong prediction, if you already know what your answer choice should be before you look at your answer choices, you actually have less work to do. And that's why you want to spend a little bit of time up front making your prediction. That's how we get points on test day. So let's keep our point train rolling. Let's take a look at another question. Okay, now here our answer choices are groups of people. Okay, kind of a little tangent from that last one. We have a researcher planning a study to determine the effect of a new medication on signal transmission at the synapse in patients with myasthenia gravis. Which of the following, control groups. This is a question on experimental design. Would provide the most accurate information to help determine the efficacy of this new medication. So let's think about it. What is a control group? As whenever I was doing my undergrad and grad work, there was a big poster that said no control, no experiment right on like the door of my lab. And I saw a lot of grad students get reamed out for not having controls. So why do we need a control? It is a very important part of any experiment. There's several types of controls that we can have. We always need a control. Generally for this study here, we would be looking at a negative control. And Taylor, I like where you're going, but let's you are correct, but I want to make sure we go through the steps. Exactly, it should compare the results in order to rule out possibilities. Your control should always be a baseline for comparison. Exactly, Sasha, to compare results to. So your control group should be identical to your experimental group, but lack the experimental intervention. Exactly, Diana. It's something you can base your experimental group off. So essentially, you're going to start with two groups of people that are identical, and then give one a drug and the other would get a placebo. That's generally how we're going to do these types of clinical studies. So that's what we want to look for. Yeah, we want to make sure there aren't other factors involved. Is it the drug that's helping? Or is it they think they're taking the drug? Or maybe they're doing something else. So anytime we're doing an experiment, we only want to vary one factor at a time. So here we're looking at patients with myasthenia gravis. So our control group should be patients with myasthenia gravis, and they should not be getting any other type of drug. So let's look at our answer choices. A is out, B is out. That's just the wrong people. C, treated with another drug. That's not what we're going for. We're looking at D. Now, there are some instances where you would compare to standard of care. For example, if you are doing a cancer drug study, you can't just like not treat cancer. So if you're doing like a cancer study, you would go for like the standard treatment of care. So either you do a placebo for where like people aren't going to like get sicker and die, or you can give standard treatment of care for diseases that require treatment. So that would be explicitly mentioned. Wouldn't be like another drug, would be like standard treatment of care if you had a question that was like, you need to have treatment. So wonderful work here, team. Let's take a look at another question here. This was another one we kind of anticipated. Notice our answer choices are back to action potentials, neurotransmitters. So we're getting back to like the disease side of things here, likely. We have in Lambert-Eaton myasthenic syndrome, the attack of autoantibodies on calcium channels in presynaptic cells results in muscle weakness. Why? All right, this is where we have to come back to calcium. Calcium we see important for a lot of things in our bodies. Of course, bone integrity is one. Muscle contraction. What else is calcium important for? Like, we know it has something to do with this situation, but what does calcium specifically do for nerve conduction or communication between nerves and muscle? We see, if we look at just general action potential, the action potential will spread from the axon hillock down the length of the axon to the axon terminal. That's all through sodium and potassium influx and effluxes. Once we get to the synaptic terminal, this is where we need to release neurotransmitter. So it's not that the action potential itself is slowed, because that's, again, that's all sodium and potassium. What the calcium does is at the very end, at our synaptic terminals, we have this influx of calcium. We open these voltage-gated calcium channels. Calcium floods into the synaptic terminal, and that triggers exocytosis. That's what allows us to release the neurotransmitter from the synaptic terminals. So if we are attacking these calcium channels, there is less calcium influx and thus less neurotransmitter release. So here we would think about, we need the calcium channels for neurotransmitter release. That is going to be answer choice C. So this question really is getting into a lot of the more specifics about nerve conduction. So it's asking you to differentiate what the different ions do in the action potential versus neurotransmitter release, because those actually are kind of separate entities, where we're going from an electrical signal to a chemical signal back to an electrical signal. And then we're also bringing in that extra bit of information about, well, if it's wrong, if we disturb the system, what is the result? And that's a very common way the AMC will test you on your knowledge of biology. So if we like come back big picture and think about what we've learned from this passage, a lot of it comes down to the fact that, well, you can tell me in chat, how much of this passage was actually tested? Was it like the entire thing? Or is it just a few key points? Coming back to that, being worried about the sheer volume of information. Because I would say, based on the questions that we've seen here, that was really just a few key points. So a lot of passages on the MCAT are really designed to throw you some scenarios that are like, I wonder. Give you some unexplained observations and then ask you to look at why that is the case. So that's what you want to focus on when you're reading the passages. And Irene, this is about 8 minutes. Now, like, we spent like almost a half an hour really breaking down this passage. As you work through like more practice, and you'll start to get faster. So like whenever we first start doing like passage strategy in our classes, we'll go through like first like what to look for to decide if this is a now versus later passage. And then we'll really focus on like reading the passage critically, where we like really just break it down paragraph by paragraph. But then by the end, like the last class, we're like, here's 2 passages, like work through them. So the classes are really designed to like start with like the basic skills and then really build up to like more independence in doing stuff on your own. So I totally can understand, like, this seems like a lot to do in 8 minutes. But as you work through more passages, as you get more comfortable with like this outlining skill and anticipating the questions, it's going to feel a lot more doable. It's just like learning how to drive. Like when you first learn how to drive, it's weird and it's awkward, but you have someone that like teaches you how to do it. It shows you what to do as you're going through and learning. And that's the same thing with like the classes. Like we'll show you the skills, we'll teach you the content, and with practice, you'll get your driver's license, you'll get your MCAT score. So, Taylor, that's actually not something we ever have to worry about. So, and that's another really great point. When it comes to like the passages, you don't want to spend too much time thinking about stuff that's not tested. So maybe it does. And honestly, it probably will. If we're stimulating the cell a lot, the receptors that are remaining will start releasing a lot of calcium, and that will give us a lot more stimulation. So absolutely, that's definitely possible. The original hypocalcemia and then the subsequent like way like getting a lot more, absolutely could. Because once we get those receptors open, like it takes a little bit longer to like get everything back. So if we stimulate repetitively, we'll get more action potential. So that is definitely possible. So I like how you're thinking. But overall, like I just want to say great work, everyone. I know we saw like some stuff that was, challenging, because the MCAT is not an easy test. I know personally when I left the testing center, I wasn't like, oh, that was really simple. But the key takeaway is that with the proper application of skill and knowledge, you definitely can master this exam. And that's something we are certainly, very happy to help you with. So if you have questions, concerns, definitely continue reaching out to us. Otherwise, fantastic work on these passages and questions, and maybe we'll see you guys again sometime in class. Have an awesome rest of your night.